with the positivity rate statewide, which is 18%. It is important to note that the positivity rate is calculated on a 7-day rolling average with a 3-day lag. That means that for today, we looked at the number of positive and total tests reported from May 2nd to May 9th. And the 3-day lag also allows time for more complete data to come in and for us to ensure the accuracy of the numbers. Trying to report the positivity rate each day would show varying fluctuations in the rate. For example, if test results were largely from congregate settings where we have been seeing higher rates of positivity, you would see a much higher rate than what you would see in a broader slice of the population. So we continue to work day in and day out to provide you data in a timely manner, but we also want to make sure that we are using it with you, the public, to inform the actions that we need to take to reopen. Now let's turn to some of the latest data in the last 24 hours. To date, 471,691 tests have been performed, of which 29,266 were reported in the last 24 hours. Regarding hospitalization, 4,626 people were reported to be in the hospital with COVID-19, and of those, 1,215 were in the ICU with 730 patients on ventilators. Since yesterday, 4,014 new cases were reported for a total of 83,021 cases for Illinois. Unfortunately, this includes 144 additional deaths for a total of 3,601 lives lost to COVID. I know some people have had concerns about the number of COVID-19 deaths that have been reported. Some are concerned that the numbers are inflated. Others think that the numbers reflect an underreporting. In Illinois, we are reporting those deaths that have laboratory confirmation, meaning that they have been tested and a laboratory confirmed test indicates that they were COVID positive. As we learn more about the disease, there may have been less typical presentations of COVID-19 that were not appropriately attributed to COVID because there wasn't a test done because the suspicion was not there. There is also some additional deaths that happen in someone who happened to be COVID positive, but where the COVID infection had nothing to do with the deaths. So we are at IDPH trying to remove those obvious cases where the COVID diagnosis was not the reason for the cause of death. So if there was a gunshot wound, an acute gunshot wound, if there was a motor vehicle accident, we know that that was not related to the COVID positive status. But in a case where someone was elderly or battling cancer, it is obviously less clear that the COVID-19, the disease associated with the coronavirus, didn't actually play a part in hastening the death. So those deaths do stand. Individuals who do test for positive for COVID-19 and die with illnesses or complications caused by the illness are definitely COVID deaths, and those continue to be counted in our count. We will continue to work to provide data quickly and responsibly and accurately represent what we are in fact seeing here in Illinois. We will continue to stay the course, and we ask you to do the same. We have to do this together. Let's keep going on. For every person's life matters, and we're doing this for all the communities across the state of Illinois.